bend pattern is the foundation of so many of the most amazing exercises that the kettlebell is known for: the swing, the clean, the snatch, many, many more. So we're going to start off with the bend pattern, also known as a hip hinge. More commonly, I would say known as a hip hinge, okay? And I'm just going to walk you through this movement, let you practice along with me, and then keep on practicing and practicing until you've got it nailed, okay? One thing that I can do at this point, if I really want to make sure that I'm keeping my back flat, is I can grab my broom handle or my dowel, I can hold onto it up at the top, it'll come down my back, I'll hold it onto the bottom, it should touch both the lumbar, or actually I'm sorry, the sacral, the mid-thoracic or upper thoracic, and also the back of the head, 3 points of contact. And as long as that dowel stays there or the broom handle stays there, then I'm keeping my back flat, okay? So that's a good assessment tool that you can use. I'm going to demonstrate without because it's a little bit easier for you to see without, and then I can grab it for a couple of reps later, but here we go. So a bend pattern is a backwards movement in the hips. Okay, so as opposed to a squat, which is a downward movement in the hips, here we're sending the hips back behind us. As a result of the hips going behind us, we have to have a significant amount of forward lean, otherwise we'd fall over backwards. So hips go back. As a result also of the hips going back, the knees don't really have a lot of forward knee drift. There is a little bit, just a tiny little bit. As those knees bend, the knees might come a little bit forward, but it's nowhere near like what they would do if you were squatting, okay? So here we go, sitting back into the hips, keeping that lumbar and thoracic spine nice and strong and nice and engaged. All those extensors in the lumbar and thoracic spine are preventing me at this point from succumbing to gravity and flexing down and falling. And of course, as you come down into this position, into this hip flex position, that's when your body has to resist gravity the most, or those muscles have to resist gravity, pulling you into flexion. So you're just going to sit back into your hips. And I like prayer hands for this right here, because I'm going to take my elbow and kind of target my mid-thigh, just as a light touch with my elbow. It just kind of comes and touches the mid-thigh and up. Feet shoulder width apart. A little bit of external rotation is fine if that's more comfortable. Anywhere from straight forward to about 15 degrees is pretty normal as far as that's concerned. Make sure your feet stay very flat into the ground. You're going to sit back into your hips and come back up just like this. Okay? And as you do it, you want to make sure that you're able to keep that flat back, that neutral spine. If you have tight hamstrings, a lot of times as you sit back into the hips, those hamstrings start to lengthen out. They reach their limit. And then as you keep coming back, the pelvis will tuck under. So it looks like this. You're coming back, 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 no problem. Then the hamstrings get all the way stretched out. And as you keep coming, then the back starts to round because the pelvis is tucking, because these are so tight. Does that make sense? So if that's the case, you may want to try stretching your hamstrings a little bit, doing active, not static, active stretching of your hamstrings before, and see if that helps. But one thing that I've noticed that really helps to go a long way to improve your flexibility is simply going through these ranges of motion with really good form. And what you should find is if you reach your limit right here, and any deeper your back starts to round, then just keep on working until you hit that limit. Keep going to that limit. Don't stop. Keep working to that limit. Keep working to that limit. And then what happens is by the end of 12 reps, you realize that that limit is 2 or 3 inches more range of motion than it was when you started your set. By the end of 3 to 5 sets, you're almost using a full range of motion within that pattern. Okay, so a lot of times it's just the nervous system doesn't know how to let the hamstrings go. The muscles themselves, they're capable of lengthening out. We're just reprogramming some things to get it to work properly. Reprogram it 1 inch at a time. So if you reach any type of deviation that you experience in your form, whether it be rounding of your back, knocking knees, external rotation, your feet going haywire in the ground, at any point in time in any exercise you're doing, limit the range of motion to the point where you can maintain good form, use really good body awareness, and focus on the area that's getting out of alignment so that you can know the moment that it even thinks about getting out of alignment. Then you come back out of the movement and then wash, rinse, and repeat. And like I said, if you use that body awareness and you keep on working, by the end of the set, you're going to get deeper. You're going to create that range of motion in this way, okay? So there's your bend pattern. You're sitting back into the hips. A lot of you right now are coming back like this and you're making the mistake of looking forward like this. You know you are. Tuck the chin, okay? If you're not tucking the chin, grab that dowel. Hold on to it up top. Hold on to it in the bottom. As soon as you lift your head up, it's going to hit that dowel and you're out of alignment. Or the broom handle. Okay? You're sitting back into your hips. Other than a rounding of the back, what is another really common mistake in the bend pattern? I would say either hips too high or hips too low. So if it's hips too high, what happens is somebody comes back, they're almost not bending their knees hardly at all, and it's almost like a straight leg deadlift. Okay, this is going to be all hamstrings, and people a lot of times who have really turned off hamstrings, muscles that are just loosey-goosey and don't have a lot of tone, they will naturally bend like this because the hamstrings are just going for it all day long, but the glutes are a little bit tight and they're preventing a normal bend pattern. So if you come down on your bend and you could rest a cup of tea here on your back, then your hips are too high. The hips should be located right between the shoulder and the knee. That's ideally, okay? Right between the shoulder and the knee. So there isn't a full parallel to the floor in your back. There's too much lean. So that's a common mistake. The other way people take it is that they'll actually be too low in their hips and they're actually squatting. Well, that's a different movement for a different time. There's a time and a place for a squat. Depending upon where your body is loaded extrinsically, we may want to bend with it, we may want to squat with it for efficiency and safety. But a lot of people have a really good squat pattern, but a really not a very good bend pattern, or vice versa. So if this is your propensity is that you're really good at squats, but the bend is kind of difficult, then take this as an opportunity to learn how to bend sitting back into those hips. The squat pattern might be a result of some tightness in the hamstrings and hips that is causing you to kind of move in that way habitually. So look out for hips too high, look out for hips too low. Definitely, like I said, look out for that rounding of the back. Make sure your breathing pattern is correct. As we learned in the core stabilizer assessment, you can tie that piece of string, or I used the headphones in that video, you can tie that around your waist at L3 and umbilical level, and as you perform this exercise, that string should go slack when you're in this hinge. Okay, that means the transverse abdominis is engaging. That's a really good sign. Okay, so practice this, get it down, make sure that your hinge is different than your squat. Move on to the next video, which is the squat pattern. I'll see you there.